sometimes we see younger women who have a really aggressive breast cancer diagnosis. It's invasive, and they require very strong chemotherapy agents. Some of those agents can make the heart muscle weak, and it's pretty well known about nowadays, so most oncologists will be watching your heart very closely if they know that if they're giving you certain type of chemotherapy agents that can affect the heart. But sometimes we do see patients who receive this chemotherapy and it affects their heart and they develop congestive heart failure afterwards. Now, in our not so younger patient populations, especially females, we see, of course, coronary artery disease, which is atherosclerosis and heart attacks. We see stroke. Of course, the older you live, the higher your risk of developing stroke is, no matter who you are. We see higher levels of heart failure, and then I put atrial fibrillation there, which is a specific type of arrhythmia. It's an irregular heart rhythm that's very common after age 70. But the thing about atrial fibrillation is that it really increases the risk for two things. It increases the risk for congestive heart failure, and it also increases the risk for stroke. So most patients, if they have atrial fibrillation, a lot of them will need a stronger blood thinner to protect them from stroke. And then the last thing that I highlighted here was Takotsubo's cardiomyopathy. If you guys listen to the news, there's been a lot of press about this condition, but it's basically a stress-induced cardiomyopathy or stress-induced heart failure. The other name for it is broken heart syndrome. So this is very common in women when between, I would say, the ages of 50 and 70, where they have a severe stress. They have the death of a spouse, death of a child, they have an argument with the spouse, and they come in, they present like they're having an acute heart attack, but they don't really have any severe blockage, but they have this condition, this stress-induced cardiomyopathy where the heart muscle gets acutely weak, and usually this will recover in 2 or 3 months after they've been on medication. Now this is my slide that I wanted everybody to see before they left out of here. This basically is signs and symptoms of a heart attack. You have usually the classic is, of course, chest pain, usually in the center of the chest pain or pressure. Most people will say they feel like tightness or they feel like an elephant's on their chest. And then most of the time, sometimes they'll have this pressure, tightness in their chest, and then it'll radiate to their arms. So they say their arm may feel heavy or numb, or sometimes they actually feel it in their neck or jaw. Their jaw may feel funny, or they feel like their teeth is sore. Their teeth are sore. So these are sometimes common signs of heart attack. Most of the time it's more common when you have chest pain and the left arm numbness or jaw pain. It's very unusual to have just arm pain by itself or jaw pain by itself and it be related to the heart. So usually it's chest pain and the arm pain, or chest pain and the neck or jaw pain. And then of course you have shortness of breath, dizziness, people feel like they're going to black out or pass out. And then some patients will have nausea or they feel like they'll vomit or have an episode of emesis. Now, a little bit about stress testing in women. As we know, stress testing in women is less accurate than men. There's several reasons for that. Women that just do a typical treadmill stress test, there's about a 30 to 35% false positive rate for women alone just with a treadmill stress test. If you combine the stress test, though, with the imaging study, so you combine it with echo or you combine it with what's called a nuclear imaging test, then the accuracy for women does increase. But it's still not as accurate as it is for men. And part of that reason is that when we combine a stress test with imaging, with women, they have the breast tissue. And sometimes that breast tissue sits over the heart, so it makes interpretation of those images a little bit harder compared to men. Now, this slide is about CT imaging in women, but for the past 10 years, cardiac CT has really begun to take foot. So basically, a cardiac CT is basically a CAT scan where they put in an IV and give you IV dye, and then they can do imaging of the heart arteries. And so CT imaging in women and men is pretty comparable. Imaging is that it can detect a very mild blockage, and then it sometimes can detect very severe blockage. Whereas CT imaging is not as good as in that middle range. But it's very good for minimal blockage and it's very good for severe blockage. Now, how CT differs from stress tests, a stress test is really only designed to pick up severe blockage. So it's going to pick up a blockage that's like 70. If you have a 30-40% blockage, a stress test will not pick that up. Okay? Now, this is the last slide that I had to answer Mr. Webb's question regarding how can we stay healthy as we get older. So these are the things we need to do. Optimal blood pressure. So optimal blood pressure now is considered to be less than 120/80. That's considered normal range, less than 120/80. Now, most physicians, we try to have patients close to this, but I would say that a lot of physicians still 140/90. So most of the time as a physician, I try to shoot to have your blood pressure between 110 on the top and 140, keep you in that range, then I'm usually happy. Okay, but you do want optimally controlled blood pressure. High blood pressure for an extended period of time can cause a lot of problems with your kidneys. It can cause a lot of problems with the heart muscle. It can enlarge the heart, cause thickness of the heart muscle wall. It increases the risk for stroke. So high blood pressure itself, we call it the silent killer. That's the reason why, because a lot of people don't have any symptoms with it, but it can be doing damage to your body. You want optimal cholesterol levels. So you want your LDL, your bad cholesterol, less than 100. If you smoke, you want to quit. And if you're around somebody who smokes, you want to stay away from them. So secondhand smoke, environmental toxins, you want to stay away from. You want to engage in some type of exercise activity 3 to 4 days a week. So usually what I tell my patients is 40 minutes, 4 days a week. That's your goal. 40 minutes, 4 days a week. It doesn't matter what type of exercise activity it is. You can combine that with resistance training, which is lifting weights, nice walk in the park, but 40 minutes, 4 days a week is the goal. And if patients can't do 40 minutes, 4 days a week, I tell them to start where they can. Do 10 or 15 minutes, 3 days a week. Take a nice walk. If you have a pet, your dog, walk your dog. Do something where you're doing something physical, getting up and moving. Because as we know, if you don't get up and move around, your joints get stiff, especially as you get older. The two diets that are studied, well studied, you Google these diets, the DASH diet and the Mediterranean diet. So those are the two cardiovascular diets that everybody needs to be trying to follow. DASH diet stands for the dietary retention. Mediterranean diet is a little different, but they both are very similar diets. They both are diets that are, for the most part, you have, lots of fruits, nuts, salads, vegetables. You don't have a lot of fried food. You don't have a lot of processed food. So it's basically just healthy eating is what those diets consist of. But you can Google those diets, DASH diet, Mediterranean diet. And then the last thing I had here is to try to maintain a appropriate body weight for our size, which is hard. But those are the things that you want to do to try to keep yourself healthy as you get older. As you get older, your risk of developing high blood pressure increases the older you get. Same thing with breast cancer, same thing with osteoporosis or osteoarthritis. All those things increase as you get age. So some of those are a function of aging, as Mr. Webb said. When you're younger, your arteries are more compliant, they're more flexible. When you get older, the arteries get stiffer. So then when they start to get stiffer, they're less compliant, they're less flexible, then the risk of developing high blood pressure increases. That's it.
We have a few minutes for some questions, and I honestly have a couple of questions before we get started, because my mother, man, a lot of skies are sitting there nodding my head, because my mother is going through a lot of that with her heart. My question to you is that women, they kind of blow off at symptoms page. I watched my mom get a headache and I just need to lay down. I've been setting up cooking and she go lay down and this is this. Then we go to the hospital. Then someone do the echo and they're saying, oh, you had 2 or 3 heart attacks. Mm-hmm. And it's hard to, I feel like we're playing catch up at that point, to where when she's in her primary and that conversation is so fluid that she doesn't express everything because there's not a relationship there. They don't express everything, and then by the time she's going to a heart specialist,